Hello, sweet zoodles, and welcome to the Botanical Biohacking Podcast. We begin with part 5 of the biology of tongue diagnosis with the sublingual veins and underside of the tongue. If you bring your tongue to the roof of your mouth, you can see two veins under your tongue. The size and shape of these veins, their coloring and protrusion, can give you hints into your body as a systemic whole. 86% of patients with rheumatoid arthritis were found to have tongues with sublingual vessels with a width of more than 2.7 millimeters, a length of more than 3/5 of the tongue tip to sublingual carbuncle. There seems to be an association between the sublingual veins and erythrocyte sedimentation rate and rheumatoid factor, which is found in 80% of people with rheumatoid arthritis. Distinct sublingual tongue presentations have also been observed in hepatocellular carcinomas. Weird sublingual veins may reflect weird disease states. Besides shape, we look at protrusion. Depending on your relative states of inflammation and vasodilation, the veins can range from being hidden to bulging out. If the capillaries get dilated, it's called telangiectasia, which is one of my favorite words. Telangiectasia. This sounds like an upwardly mobile 4-year-old at a Montessori school. If you're wondering what to call your non-binary kid, consider telangiectasia. Telangiectasias can be seen with systemic sclerosis and primary biliary cirrhosis. You can also have hereditary telangiectasia. This is a little tricky because very few of us are familiar with the underside of their grandparents' tongues, and those of you who are very familiar aren't talking about it. Color. The color of the sublingual veins will vary from dark purple to light blue. And to be honest, I have a confession to make. Initially, I would treat people with purple or brilliant sublingual veins with blood-moving herbs. The results were great, but later I would have trouble helping what appeared to be a deficiency of qi, so their tongue would be fat and pale. Maybe they had stabbing pain before that went away, but then they found a dullness and lassitude down the line. So later I came to learn where I had been making a mistake. Dr. Jin Zhao in Chengdu explained that I was overlooking water retention and potentially helping pathogenic microbiota to spread throughout the body. Sure, I was helping with the blood viscosity and necrotic tissue, but while I was helping the patient, I was also accidentally helping pathogens further invade their tissue. He then taught me a method that's pretty straightforward to ensure that I didn't make this mistake again. The first question to ask is, are the veins bulged? The second is, are they dark? And the third is, whether the tongue body is fat. If the veins are bulged, and the color is not dark, and the tongue is not fat, then it's heat. It's a sign of inflammation. If the tongue is bulged, and the veins are dark, and the tongue is fat, then yes, the blood isn't moving, but it's because dampness is blocking the blood circulation. We need to get water out before looking directly at improving blood circulation. Finally, there are protruding sublingual veins under a tongue that is not fat and it doesn't have a thick biofilm. This is what you see when there's pure stasis and the circulation may be influenced by deeper problems around trauma and platelet adhesion. You see this with motor vehicle accidents. Somebody's in perfect health, but they have some trauma. They're getting blood circulation which is compromised by that trauma. There's necrotic tissue in the back alleys and capillaries of the body, and it's affecting the systemic blood circulation, especially with neck injuries. you'll start to see purple under the tongue, under the sublingual veins. And in these cases, it's purely a question of improving blood circulation and removing that necrotic tissue. Bloodletting can also be good if you have an area where there's been an injury and there's necrotic tissue there. The blood is just like a severe bruise. You do very light bloodletting to get that black foamy blood out of there. That's necrotic, and it starts to become like gather swamp gases that you really want out of the body, because it will impair systemic blood circulation as a whole. The sublingual vein may be a window into blood pressure as well. Changes of blood pressure can lead to formation of abnormal sublingual veins by increasing the expressions of vegetative endothelial growth factor and HIF-1 alpha proteins in sublingual tissues, at least in dogs with portal hypertension. On the underside of the tongue, there's also something that's really weird. There are these fringe-like projections. They're like skin-tag tentacles, and they look creepy. These are plica fimbriata, and these come on either side of the deep lingual veins. It sounds like a Harry Potter magical spell. Plica fimbriata. According to Beijing Men, an expert on tongue diagnosis, this is a sign of a tendency toward tumors and cancer. Good Lord, is this true? I mean, it kind of makes sense, right? Weird growths. I found this out and immediately checked my tongue to see if my tongue had these weird little projections sticking out. You know what? Go ahead and check now, as long as you aren't driving. Yeah, just take a moment to look. I would if I were you. No, it's fine. Yeah, I'll wait. So yeah, you're looking for these kind of almost hair-like structures that are going out, kind of like a mushroom. See anything? No? Okay, good. I looked into this to see if there was any research to substantiate a correlation between plica fimbriata and tumors. In the early 1900s, scientists in the West looked at it and said, "What the hell is that?" Shrugged and moved on. This happened again in the 50s and 60s with the same conclusion. What the hell is that? Well, it doesn't seem to be hurting anybody. Who cares? Reddit users are apparently checking for them and removing them with nail clippers. I would not advise doing this. There are certain signs of oral cancer which can be found in the mouth and under the tongue, which are great to look for if you're doing tongue diagnosis, such as leukoplakia. Make sure that that's part of your usual examination. But is there a true connection between tongue tentacles and cancer? I don't know. To the best of my knowledge, after checking PubMed for 2 hours, I didn't find anything suggesting that it has. My best bet is based on the fact that the tongue makes heavy use of hedgehog signaling for its growth, repair, and development. Hedgehog signaling makes sure that you have 2 ears and 2 eyes instead of 3. It's also responsible for organizing new tissue growth. Perhaps these weird projections under the tongue are a sign that hedgehog signaling is off, which may predict further deregulation of tissue growth down the line. Perhaps this is true of skin tags as well. You don't tend to see skin tags in small children, but as people get older, they become a little more common. So yes, it's highly speculative. Currently, it hasn't really been tested either way. To the best of my knowledge, skin tags are not indicative of cancer. However, if we're looking at hedgehog signaling as the common structure or mechanism behind both, it may be worth looking into. Ultimately, sublingual tongue diagnosis alone doesn't mean anything. It needs to be viewed within the context of your overall diagnosis and with regard for their lifestyle. A professional athlete with bulging sublingual veins will likely require blood moving or even minor bloodletting to release necrotic tissue from all of the activities they have which require them to get banged up. A more sedentary person may need to have their water metabolism brought into check first. For a very elderly person, it can be an early warning sign of high blood pressure, and they may be in need of blood pressure medications to keep their brain from being bashed with every beat of their heart. All of these methods may be appropriate based on the individual. Where I find sublingual tongue diagnosis to be incredibly valuable is that it serves as a bridge between the examination of the tongue and the pulse. And we're going to get into that in the next episode. Thank you so much for listening to the Botanical Biohacking Podcast. I'm your host, Dr. Andrew Miles.